Good evening for everyone. Thank you for having me. I'm Dr. Jose Armando Arronte Villamarin. I'm the head of the International Organization Department at the Ministry of Public Health in Cuba. And today I want to share with you some ideas about the 62 years of the Cuban International Medical Cooperation. But if we are going to talk about the International Medical Cooperation of Cuba, it's very important to understand, first of all, some issues. For example, that the health in Cuba is a human right that is included into the Constitution of the Republic of Cuba, because the public health is a right for all the citizens and a state responsibility. Is one of the most important things that you need to understand. The other thing is that the principles of the national health system. Some of you know that Cuba, the health is free of charge, is universal, is regionalized. But one of the principles is the base of the international medical cooperation, is the internationalist conception. The other thing that is important to know is how has been possible for Cuba to make the huge international cooperation story. And it is important to understand that at the triumph of the revolution in 1959, we had in Cuba around 6,000 medical doctors. The 50% of them left the country after the victory, and the leaders of the revolution realized that it could be impossible to improve the national health system or the national cooperation without health professionals. And then we decided to do the training of the medical doctors, nurses, and technologists. At the end of the last years, we were in Cuba more than 75,000 medical doctors, and the ratio of the medical doctor per inhabitant is 7.4, one of the highest in the world, and that has been possible thanks to the training. For example, we have in Cuba at the end in 1959 we had only one faculty of medicine, but currently we have the 30 medical sciences university, 29 faculty of medicine, Latin American School of Medicine, and the National School of Public Health. And the teaching staff is more than 32,000 professors in the staff. The Latin American School of Medicine is, okay, some of you are going to talk about the Latin American School, the ELAN, but just only to say that it was founded on November 21st, 1998 by the Commander-in-Chief Fidel Castro Ruz, and the purpose was training free of charge doctors from Central American nations and the Caribbean, devastated by the hurricanes George and Mitch. More than 31,000 graduated from 122 countries in Latin America and the Caribbean, Europe, Asia, and Oceania. Not only in Cuba, the training in human resources in health is not only in Cuba, because Cuba have been creating faculty of medical science in different countries, for example, Yemen, Guyana, Ethiopia, Uganda, Gambia, Equatorial Guinea, Haiti, and Eritrea. But if we are going to talk about the 62 years of the collaboration in health, we have to begin by in 1960. Was sent the first medical team to Chile after the earthquake that was there. But officially, we recognize 1963 in Algeria, the first brigade. Since that day, more than 605,000 internationalist mission in 165 nations, with the participation of 400,000 health workers. Currently, we are working in 56 countries with more than 24,000 collaborators. As I said before, in Chile, May 21st, 1960, Cuba provides its first medical aid for disaster, the earthquake in Valdivia, 1960. In less than 48 hours, a plane was sent to Chile with the medical brigade and 8 tons of medicine and food. Historical value of that cooperation was that the then Senator Salvador Allende accompanied to the Cuban medical brigade, and he felt before to be the president of the country that the humanism and the feeling of the Cuban health professional. But officially, as I said, we recognize that 1963 is considered the year in which the Cuban International Medical Cooperation officially began by sending the first medical brigade to Algeria on May 23rd, made up of 57 health professionals to provide medical care for a year. Why we recognize Algeria at the first? Because in Algeria we stay for a long time. Even currently we have a medical team in Algeria. But one of the other important things that happened in relation with the International Medical Cooperation was the Henry Reef contingent that was founded on September 19, 2005. I remember that I was in Havana, as I said in other moments in this type of conference, when the Commander-in-Chief was expecting the answer of the government of the United States after the hurricane that affected New Orleans. I was ready, and some of my colleagues were ready to travel to New Orleans to provide medical care, but unfortunately the government of the United States didn't accept the Cuban support, and then the Commander-in-Chief decided to create the Henry Reef Brigade, specialized in disasters, epidemic, and others. Of the Henry Reef contingent, we have sent 89 brigades to 57 countries with more than 13,000 collaborators. 3 brigades faced Ebola in West Africa with 265 collaborators, and recently 58 brigades faced the COVID-19 in 42 countries. The milestones that mark the evolution of the Henry Reef Brigade is 2005, the Pakistan earthquake, in 2010, Haiti, another earthquake, and 2014, the Ebola in West Africa, and 2020, the pandemic of COVID-19. For example, in the West Africa, in the Ebola, we sent 256 Cuban collaborators to this. Of this, 165 professionals traveled to Sierra Leone, 38 for Guinea-Conakry, and 53 professionals to travel to Liberia. Another important program of the International Medical Cooperation of Cuba has been the Miracle Mission. It was created by the leaders of Cuba and Venezuela, Fidel Castro Ruz and Hugo Rafael Chavez Frias, in July 8, 2004. More than 3 million of ophthalmologic surgeries has been performed: cataract, pterygiums, glaucoma, and many others. And the name Miracle Mission is because the people in 48 hours they recovered the vision, and that's a miracle. Some of the results of the work of the Cuban Medical Corporation and those 62 years, for example, consultation that we have been doing, more than 2,308 million of consultation in different countries. Total of surgery, more than 17 million. Deliveries, for example, live birth that we have been doing in different countries, more than 5 million. Life saved, more than 12 million. The vaccines that we applied is 18 million. And Miracle Mission, as I said before, surgeries, more than 3 million. But despite these results, on this government of the United States, the the Secretary of State, Marco Rubio, has launched a campaign against the Cuban Medical Brigade, accusing them of human trafficking and modern slavery. He has been pressing to the government of the countries that receive Cuban medical cooperation and applies sanctions to the leaders and individuals linked to this collaboration. But of course, he is totally wrong. But just some idea to dismantling the false campaign of the little Marcos. And you know why I say little Marcos. First of all, this is a baseless falsehood. No one of the internationally recognized characteristic of human trafficking apply to this activity. Humanism, saving life, but not human trafficking. The Cuban professionals who participate do so voluntarily. They know where they are going to stay before their departure. The slaves that were brought to America from Africa, they didn't know the place where they were going to, the final destination of them. And they didn't receive the money. And it was impossible for them to move, the free movement. But this is not the situation of the Cuban health professional to travel to other countries to provide medical care to those peoples. And the other important thing is that they have complete freedom of movement on the countries where we are working. All of them receive their full salary and accumulate pensions in Cuba while serving in another country. Furthermore, they receive a stipend in the destination country, often higher than their current salary in Cuba. Their accommodation, transportation, and often food costs are also covered. Then you will understand, you will be agree with me that little Marcos is totally wrong. Finally, I want to say something about the internationalism in health with the phrase of Commander-in-Chief Fidel Castro. We must experience solidarity with all those who suffer, even if we have never seen them in our lives. Thank you very much for this opportunity for me, and hasta la victoria siempre.